Hi, everyone, and welcome. We have a very special presentation. We have Representative Schofield, who is here with us today. She is from Atlanta, the Georgia House of Representatives, and she has something special that she is going to present, a proclamation for PAD Awareness Month. This is a first for the state of Georgia, and I think for the entire South, where some of the highest amputation rates are occurring for patients who have advanced stages of what's known as peripheral artery disease, which is poor circulation in the legs that left untreated, undiagnosed sooner rather than later can lead to critical limb threatening ischemia or CLTI and ultimately amputation. I met Representative Schofield just recently at an incredible event in Atlanta, where they were doing all kinds of testing, free testing for people in the most vulnerable communities in Atlanta, Georgia. And we had a great conversation, Representative Schofield, and that led to you providing this monumental, I would say, proclamation for PAD Awareness Month. So I'll leave the floor to you to present it, but know that we just appreciate you doing this and helping us to raise awareness for a disease that's more prevalent and deadlier than most cancers combined.
Well, thank you, Kim. And I am so appreciative to be here with you today. Listen, it was no accident that we met. Your name, first of all, is Kim, so it's a Kim thing. But second of all, it is the contagious, infectious spirit from which you drew me in with your amazing work on artery disease. You know, this PAD is an issue that I came in contact with some work through So Everybody Can Move and doing awareness around limb loss and orthotics and prostheses care. And this was something that when I met you, it's a continuation of the great work that's started by great people like you in the organization, the advocates, and many of those that are living and impacted by PAD. You know, September is this month, and it's our month for us to bring attention and awareness to diseases that are often overlooked and not discussed. As a person who lives with lupus, I understand the importance of making sure that those that have invisible or hidden disabilities or have a voice. And so PAD, and I've lived with lupus for 25 years, which is how I ended up in the General Assembly through work like yours with advocacy. And so it's the voice of the people that impacts the most and the voices that are boots on the ground that really get the attention warranted that we need to move the needle along to get others on board with this amazing initiative. So I am so excited and happy and honored. I represent Atlanta, Fulton County in particular, where the airport is. That's my district. I've served for 8 years. I spend most of my days in the health committee. So everything healthcare is what I do. And health is a continuation. It's a human right and not something that is selective. So as we know, September is Artery Disease Awareness Month. I wanted to make sure that we're partnering with the Global PAD Association to bring this awareness in Georgia. This is the first step of many initiatives that we'll do together. So, on behalf of the Georgia General Assembly, I'd like to read the resolution. Whereas artery disease, PAD, represents a critical public health emergency affecting millions of Americans, with Georgia being a region of particular concern due to high rates of risk factors such as diabetes and obesity. And whereas PAD is a significant health burden, approximately 21 million Americans currently are suffering from this condition, according to the most current epidemiology study data. And whereas the American Diabetes Association reports that 85% of PAD related symptoms are preventable, highlighting the urgent need for early detection and intervention. And whereas Georgia ranks among the top 20 states with the highest diabetes prevalence, with 12.7 of adults living with diabetes and approximately 35% living with obesity, both primarily precursors to the devastating complications of PAD. And whereas research shows significant racial and ethnic disparities in PAD diagnosis and treatment, with Black and Hispanic patients experiencing disproportionately higher rates of amputation covered by compared to white patients. Really, it's 2.2 times higher in Black patients and 1.36 higher for Hispanic patients. And whereas major amputation costs approximately 13.4 billion in annual direct medical costs alone. I should say that again. It's
Yeah.
$13.4 billion annually in direct medical costs, with Medicare and Medicaid covering almost 80% of these expenses, representing a substantial economic burden to the taxpayers. And whereas studies indicate that 70% of PAD patients have not received a pulse examination from their primary care provider, despite presenting symptoms such as leg pain, leg cramps, neuropathy, numbness, and non healing lower extremity wounds. And whereas early detection of PAD can reduce the substantial risk of subsequent cardiovascular events, with 1 in 5 undiagnosed patients likely to suffer a heart attack, stroke, or death within 5 years. Now, therefore, be it resolved that September 2025 is recognized as Peripheral Artery Disease Awareness Month in partnership with the Global PAD Association. And whereas this resolution will be adopted again in January in the House of Representatives. But today I am honored to present a resolution recognizing September 2025 as Peripheral Artery Disease Awareness Month.
Oh my God. You're just, I'm speechless. I mean, it's one thing knowing it's coming and then hearing you say it and making that declaration and knowing it's going to have a final, official adoption in January. It just, it's huge. It is truly monumental. And I just, from the bottom of my heart, I just thank you for being a pioneer and being that official patient advocate, that led you to where you are and continues to make you successful and impactful across not only your community in Fulton, across the state of Georgia, and I think across the nation. This is amazing. And I think I would love to see so much more going forward and partnering going forward with even leading the way in the South and creating legislation that we can't even get Washington to do. It keeps stalling out, which would require testing for patients with high risk factors, whether it's lupus, whether it's diabetes, whether it's smoking, high cholesterol, high blood pressure, for everyone over the age of 40 for PAD, because you're right that there's so much that these patients can do to mitigate those risk factors and prevent the progression of disease. So they never have to deal with procedures. They never have to deal with the amputation. And so that's where I would love this to go next. And you are definitely the woman to make that happen.
Well, thank you. I can't do it without partners like you. Listen, I tell people we have the power of the pen in the legislature, but you have the power of the voice. And when the two come together, we are able to move the needle and impact change. So, to all that are impacted by this, don't give up hope. Let's keep fighting. Let's work together. Let's work across these states in your legislative body and get people to recognize us, make them hear PAD. That's what we're on a mission to do. And we'll do it legislatively, we'll do it raising awareness, but the fight, we're taking the fight to them, and then we're going to bring the fight to the House.
I love it. Is there any email or any way that patients with PAD in the state of Georgia can share their story with your office so that you have more ammo in your fight to save life and limb in your state?
Yes, I would love to hear from my fellow people who are living with, I don't call them disabilities because we're not dis anything. What we are is
Mhm.
we're able to determine what are our challenges, but also we can work on our barriers. And so they can feel free to reach out to me at 404-656-0298. That's 404-656-0298, or email me at kim.schofield, Schofield, at house.ga.gov. As I tell people often, Kim stands for Keep It Moving. And so we're going to keep it moving with peripheral artery disease. We're going to raise awareness. We're going to get some legislation, and we're going to make it happen.
And I love it. You're KIM, I'm KYM. So I'm just going to keep you moving.
I love it. I love it.
You're the best. I won't keep you. I know you're busy. Thank you from the bottom of my heart. I look forward to working with you further. Anything you need from our end and our support, we are here. We are with you every step of the way, partners in saving life and limb. Thank you for the proclamation and all you do to help save life and limb across the state, now having an impact and lead.